Hi, my name is Dr. Ashok Mittal. I'm a senior consultant neonatologist and pediatrician at Fortis Hospital, Anandapur, Kolkata. So pollution is actually one of the most important factor, or rather concern, that the country is facing or entire world is facing. Recently, you must have heard some of the cities in India have extremely high AQIs. More than AQI, it is also the PM 2.5, which matters the most when it comes to chronic allergy, cough, rhinitis, sinusitis in children. Now, often I'm asked about by the parents about how to tackle this condition when the AQIs are very high and the pollution outside is very high. Now, there are 5 things that we may consider. Number 1, clean the air indoor. So how can you do that? You can have an air purifier which is having an HEPA filter. This should be according to the room size. The windows and doors must be closed, especially in the early morning and evening. These are times when the smog and the pollution is at its peak. Please ensure that ventilation is happening from time to time and humidification is also correct. If you are in one of those dry states where humidity is low, then you must use a humidifier as well. Do not add any other smoke other than the air pollution, like incense sticks, scented candles, cigarette smoke, or mosquito repellent, etc. So these must be avoided at all cost. And lastly, I would say that the indoor plants, some of the plants like snake plant and other plants can help a little bit, but not a huge amount of protection can be achieved from them. So clean your indoor air quality, that is number 1. Number 2 would be limit the outdoor exposure of the air for the child. So you can avoid going to the park, to the schools also, especially if the AQI is more than 200. The times which are dangerous is basically, as I said, early morning and evening. These are the times to avoid, and the schools will also have an advisory, I suppose, when the AQI goes very high. Prefer a midday kind of exposure outside. Use a perambulator if your child is small. A perambulator cover is available which can reduce the exposure of the outdoor air. And if the child is above 2 years of age, then you can use an N95 or N99 mask also. Using a mask in a child less than 2 years of age is strongly contraindicated, because this can hamper their breathing and can cause serious problems. Number 3 would be avoiding dusting at home, and I would prefer a wet mopping of the house or at least the room where the child is residing at least 2 to 3 times a day. That kind of settles down the dust and doesn't let it be in the air, which if dust will be there. Number 4 would be to keep the child adequately hydrated, giving him enough vitamin C rich food like oranges, amla, kiwi, etc. And also intermittently use saline nasal drops in the nose. So just to clear the nose. Last but not the least would be that if your child is a preterm or a low birth weight or is a known asthmatic who has been needing inhalers or nebulizers from time to time, these are the children with high risk, or even with cardiac disorder or known kidney, cardiac, or any other chronic diseases. These are the patients who need to consult the doctor, the pediatrician, even in first 1 or 2 days of coughing or fever. Early opinion can help a lot, especially if you have breathing problem, coughing more than 2 to 3 days, or if you have an audible wheeze or these are associated with fever, etc. Then these are situations when you actually need early consultation with your pediatrician.